Well, welcome everybody. We're here to talk about why knowing your pharmacy's finances is so critical and how it puts you in control. There's been so much uncertainty here in 2024 and January 2024 that it's kind of knocked a few people off their feet a little bit, but getting back up. And so now what do we do? And so we're going to get into why and what are the specifics that we need to know about regarding your financials and in this particular environment with the things that are happening today. And so I'm really excited to have a couple of experts on the call with me today to be able to go through and talk about what we can do and what they're here to share with us that we can do to be able to make a difference in 2024 and most importantly here in this particular environment. So I am joined here by Owen BonDurant and Tim Clark from Independent Rx Consulting. So Owen, you have been in the business now, pretty much all your life, right?
Yeah, it's starting to get a little weird to say that maybe like 30 some years.
30 something years.
On and off, I guess.
Yeah, and your experiences as an owner, and you've worked in pharmacy, and you've worked as a technician, and you've started pharmacies, and you've run DME. So you really run the gamut of understanding what our owners and our members are going through.
Oh yeah, for sure. I'm probably the only person who has done more than me would be Tim.
Yeah, and so Tim, thank you for joining us. Tim is a pharmacist and was running a family business, third generation pharmacy, both right in working in the business and as an owner.
Thanks for having us on. Yeah, I've been, now that Owen says 30 years, I've got 40 some years into this. I think our parents just threw us into business when we were kids stocking shelves and stuff. And we both went similar directions. I went to pharmacy school, Owen went to business school, and we ended up teaming up together and continuing to work on our family's business.
That's fantastic. That's fantastic. Well, thank you both for your commitment to the industry and to what all of the owners out there are doing and to what you've done for your communities. I know IPC and Independent Rx have been working together for a really long time, and advancing the financial literacy of independent pharmacy owners, of course, is something that we are both really passionate about. So given the changes that that have just happened, would you share with us, like, what are the real key things that our owners need to think about in terms of their finances and the financial numbers that they need to know?
Well, I think when we think about that, Matt, I think the way we've always run our business, and it always comes down to us, like, to a core few things. And you've got them on the screen here. You've got your gross margin and gross profit percentage. You have payroll, and then inventory and AR really make up gross margin and gross profit. So, your gross margin is just your revenue minus your cost of goods, and you get what's left after you pay for the drugs. So when you're looking at this, there's revenue, there's your gross profit, and your biggest non-drug expense is payroll. And so those are the three things that make up your finances. And we find people sometimes get their eye off of the most important piece. So really understanding those three things and what makes up those three things within your business is where to concentrate.
That's great. So when you think about gross margin, though, is there a target or an average, or does it depend on the type of business?
Yeah, it will depend. We see, NCPA, and even in our client base, we see averages around 20% is kind of your gross profit percentage we see. But, things like compounding, long-term care, OTC items will drive that up. So that's kind of where the baseline is. And some of that is controllable and some of it isn't, right? And what you're trying to do is gain revenue, pay less for the drugs, so you have a bigger gross profit, or have revenue that maybe has no cost of goods to
Such
drive up
as?
what's left. Clinical services. So that's obviously a big hot topic right now. Things like,
Sure.
I mean, MTMs were the original, right? But now you've got diabetes education, smoking cessation, RPMs, remote patient monitoring is becoming, is getting passed from doctors to pharmacists now. It is just an endless kind of thing that you can grab a hold of and specialize in and drive additional revenue from your current patient base, but also drive new revenue that's high profit margin. But you've also got other things like immunizations, compounding, long-term care. You know, a lot of people are doing the hybrid model where they're, you know, billing a long-term care contract for homebound patients. So finding things that can increase your gross profit and spending time on that is where it seems so simple.
Right.
I need to concentrate right there, but sometimes when you're trying to fill scripts and you're trying to, you know, do marketing and you've got an employee called off, like you can easily get your eye off of that one thing that's driving your business.
Yeah, really good. Tim, do you have any examples of going back to what Owen just shared related to the differing other services that may not have cost of goods associated with them to be able to drive higher profit margin revenue into the business? Do you have some examples of, you know, either your experience or some of your clients that on how they were able to implement some of those programs?
Well, there's still some opportunities when it comes to things like diabetes intervention or counseling, where people actually will pay for services, cognitive services. And the biggest advice I usually give to people, instead of saying I'm going to focus on all these different things like immunizations and point of care testings, and limit it to like one or two things that they can put an action plan together so that it's part of their workflow. You know, typically we end up going to these conferences and we hear, here's 8 different ways to make my pharmacy more profitable, when they end up, you know, it's like analysis paralysis. I've kind of put myself in a position that now I'm not doing anything because I've got all these great ideas. When, for instance, we talk to owners, we explain to them, you really need to look at, you know, what can differentiate my pharmacy and be a niche and sell it. You know, if it's packaging, if it's compounding, if it's service, if it's your immunizations, if it's travel, if you got a nurse practitioner, find something that makes you different. Anytime that we have found that we try to be a big chain store or fill, let's say, a lot of brand name prescriptions, we make no money. So we really got to know what those opportunities are, and pick something that you know that you can do and your staff can do.
That's great. That's really good advice. Pick one or two things, set a differentiator, make a plan, and move on it. So Owen, you mentioned payroll as a percentage, and we showed that earlier in a previous slide. So how is it that I should be looking at payroll as a key financial indicator of the business?
3 things there. One, you know, payroll is your biggest expense. When you look at a financial statement, all your other expenses will not be as much as payroll. So that's why it's on here. And we look at payroll in 2 ways: as a percentage of sales.
Okay.
So we're seeing with revenue per prescription going up, you know, people are targeting kind of 9-10% of sales. But your type of pharmacy is going to impact that. So for example, if you're specialty, that would be bad because your revenue per prescription would be so high. If you're long-term care, your revenue per prescription is lower. So the other way you want to look at this is fills per employee per hour, right? So are my employees filling 15 prescriptions an hour or 20 an hour? And is that going up or down? Because that really starts telling you how efficient your staff is being. And we actually break that down by pharmacist, tech, admin. So that way we know, are the pharmacists, are we just not being efficient in the pharmacy, or are we not efficient in tax? Like where's the inefficiency?
Excellent. Excellent. Really good. The next one we had on the list was inventory. So talk to me a little bit about how I should be looking at inventory value and turns.
Well, your inventory, now that we've gotten it that we get an order every day from our wholesaler, even if we're getting it, through a secondary, we get it very soon. We don't need to keep 3 months worth of inventory on the shelf. You need to be looking at trying to get inventory turns closer to 15. So somehow that they mimic what your pay cycle is. If you're paying weekly, then you need to have your turns increase more, because the amount of money that you end up investing in the inventory gets exasperated. Doing things like trying to get people on auto refills for especially their brand name medications, or syncing all their medicines, can put you in a position where we don't have to pay for that medicine before we get reimbursed for it. What I find a lot of people not doing it are two things, very simply. They're not looking at their wholesale bill until it's the day it's due. You can look to see what we're investing every day in our wholesale and kind of decide, does that really make sense based upon our sales for that week? And some of it is that our automations are set up in our systems for perpetual, and we've got our settings wrong, or that we're not even using any perpetual system, and then we're emotionally buying, and then you've got all hands on deck, where you've got too many people who can order stuff, and they don't understand that when I order something, those are dollars on the shelf.
Yeah. So how often do you recommend looking at your inventory value? Is it monthly?
Every day, like part of your closing things. I mean, and the reason I say that, Matt, is like if you don't look at it every day, then you're not going to think of it is it a weekly importance? No, like it's with the way it works with returning stuff to your wholesaler too. You only have so much of a window to return and get it off your next statement. So if something's messed up now, it's better to see that. And it's not in all these pharmacy systems have, especially if you perpetual inventory, you can run that report in like 5 seconds.
Yeah, really, really good insight. So the last financial number that we had on the list was accounts receivable, and I have to admit I've seen some stores let this get a little bit out of control. Share with us, how to keep an eye on this and why it's so important to focus on it.
Well, the first thing I'm going to say about accounts receivable may be a little bit different than most, but your best way of monitoring your accounts receivable is also every day looking at your bank account. The way the times have come with our automated deposits, even the ones that we get from our PSAOs come on a routine basis. We can kind of see the rhythm of the cash coming in, and again, it's very important to make sure that, I did not get my Express Script payments, and I thought it was on a Wednesday. You can almost chart these things, to help you understand your cash flow, and as you see that the cash coming in is not what you expect based upon your pharmacy sales. I mean, you can really start to see that, I've got an accounts receivable problem. Every PSAO or wholesaler offers some sort of AR program, and so does your pharmacy systems. Now the problem with all of those is that they're all retro. I mean, it takes them forever to match up the claims adjudication with when we get receiving the money. So again, it's kind of like that wholesale bill where you've got to do this on a regular basis, not just, oh my gosh, my accountant's asking me for an AR number. I mean, dude, you should have a guess of what your AR is. Back in the day, even my dad, we'd have a chart. This is when we get paid from. Let's say it's Caremark. This is when we get paid from UHC. Like you need to you need to figure out a way to monitor it, and your bank statement is the easiest one to see.
And to put it in simple terms, Matt, that, you know, AR, you have to have reconciliation. There's software to do it, but that is a tool for you to use when you see there's a problem. And what Tim is saying, if your Caremark check is always 50 grand and it comes in at 30, it's time to start looking at your reconciliation to see if you're not getting paid for something.
Right. Great. Thank you. Thank you. And so, you know, as we were prior to this call talking about, you know, these numbers and we talked about how to then therefore structure your books to be able to see these figures more effectively, more accurately, and more consistently. So share with us, you know, how you would think about structuring a book so that, you know, the owners are paying attention to these numbers that are critical to understand, especially given the environment today.
I think this goes back to what Tim said earlier about trying to figure out one or two things. You want your books to be structured so that you can see what are the one or two things I need to focus on, right? So for example, we have down here like breakdown sales by payer, okay? Well, if you see that you do a lot of Caremark sales, or Express Scripts is probably the better example. You have a lot of Express Scripts and you know you don't make money on that, and you're doing a whole lot less of Caremark, well, then we should be targeting Caremark patients. And I know that sounds simple, but if you don't even have a breakdown of that, how are you supposed to know where you are? And you don't know where to focus. And so what we're trying to do with the financial statements, and what we get a lot is sales, cost of goods, payroll. Well,
but not the details.
It doesn't tell me, you know, under my cost of goods, how much did I buy from my primary? How much did I buy from my secondary? Did I get my return check? Did I get my rebate? Right? And so so that means you've got to go figure that out later.
Yep.
And guess what happens is then an ice storm comes, things get shut down for 2 days, your tech calls off, and then you just never do it. Well, if you've got that information in play and you see that your rebate is half of what it was last month, well, then you can go, did I buy wrong? Do I need to call IPC and have them look at it? Like, you can quickly solve the problem.
Right.
Yeah, you know, you've got, you know, a lot of your sales right now, Matt, are coming through our PSAOs. And, you know, even if the owners would just break out the PSAO revenue from the other checks that come in, it would really help them kind of know where to look for where the money is. And the same thing on the purchasing side, you know, at least have a line for your primary wholesaler and then a secondary grouping, so that so when you get into the details of trying to find the problems, you can. And the other thing, again, I'd press everybody is to, you know, as they're working with their, you know, accountants and bookkeepers or whatever, don't ever satisfy that you're going to wait, you know, 4 weeks to get data that's 4 weeks old. I mean, you've got to really push everybody to get close to just-in-time information, or you're going to lose things. But you know, the big things we can handle, you know, without a lot of work is I can handle my payroll because I have probably a payroll system. I can handle my purchases because most of it comes from my wholesaler, and I can look at that, and I can look at my bank account.
Right.
I mean, I've been doing this for 40 years, and every day, you know what I do? The first thing, Matt, I log into the bank and I see how much money we got. Yep. And then I click on it to see like where it came from and where it went.
Yep.
I mean, it's,
well, yeah.
I mean,
you know, I know you guys do a great job of serving your clients by being able to share this information. And so I really appreciate you sharing all of this with us to be able to help our owners and help all pharmacy owners understand the details of what it is that they need. If you wouldn't mind, just share, a little bit more specifically about how you and, take care of your clients to be able to offer these services specifically.
I mean, we primarily do three things. We walk people through the life cycle. We help people buy and start pharmacies. Okay, so we will help them identify the store to buy, take them through due diligence, financing, changing over licenses and insurance contracts. And same in start, you help someone start, find a location, get licensed, get open, right? And then we do accounting for pharmacies. So the bookkeeping, delivering financials monthly and on time, doing tax planning and tax advice. We also provide a dashboard of other key metrics out of our pharmacy system. And then we help them, and then eventually they need to sell, and we help them sell their pharmacies when it's time to exit. And that's what our business is.
And everybody, Matt, as you know from being in this industry, I mean, everybody's got a little bit different spin on all. Every store, it may look like there's 20,000 independent pharmacies that are the same, but there's probably 20,000 are all doing a little bit differently.
Yep.
And what we found is we recognize that, and that's what's great about talking to them, because no one is the same, but everybody needs someone to bounce some ideas off of and wants to be successful. I mean, I think that's probably why we align with your group so much, is that you're just trying to keep these people in business and successful, give them an ear and some advice. And it's the same for us.
And I think we can do that, Matt. I mean, part of the reason we've done so well is that we own pharmacies ourselves.
Right.
So, we're doing the same things that our clients and your clients are doing. And so some of that is just listening and understanding exactly what they're going through.
Well, my experience is that having someone who understands the industry and understands it to the level that you do and to the level we do is so critical, because it is so unique. And I think Tim put it beautifully that everybody's business is a little bit different, but at least if you have the foundation of understanding the industry itself and pharmacy, you really have the opportunity to provide the proper guidance and consulting that pharmacy owners really need. So, gentlemen, thank you so much for spending this time with us. I know, right now we're hearing from all of our members and clients that things are a little unsettled in 2024. And I think this is going to help give them a little bit more clarity that they can take control over what's happening to them and move their businesses and move their pharmacies forward. So thank you so much for that time. I really appreciate it. And looking forward to a successful 24.
Yeah. Thanks, Matt. Appreciate it.
Great. Thanks.
Thank you.